The cancer cells had been unstoppable for weeks, multiplying with ruthless efficiency in the petri dish. Their chaotic dance of division had mesmerized researchers at Harlem Hospital throughout the spring of 1949, each cell splitting into 2, then 4, then 8, an exponential explosion of malignancy that mirrored the disease's behavior inside human bodies. Then Dr. Jane Cooke Wright added 3 drops of methotrexate to the culture medium, and everything changed. The transformation wasn't immediate. For the first hour, the cells continued their relentless multiplication, seemingly oblivious to the chemical intruder in their environment. But Jane Wright remained at her microscope, adjusting the focus with steady hands, her dark eyes fixed on the cellular battlefield below. At 2:15 that Tuesday afternoon, the miracle began. Cell division slowed, then stopped. The unstoppable had been stopped. Jane lifted her head from the eyepiece and glanced around the empty laboratory. No one else had witnessed this moment, this quiet revolution that would transform cancer treatment forever. She made a careful notation in her lab notebook, her precise handwriting recording not just the time and dosage, but the beginning of hope for millions. The Wright family dinner table buzzed with medical terminology most children couldn't pronounce. Jane Cooke Wright grew up in a household where case studies were discussed over pot roast, where surgical techniques were debated between courses, and where the pursuit of medical excellence wasn't just a career choice but a family calling. Her father, Dr. Lewis Wright, had shattered barriers as one of the first black physicians to practice at a major New York hospital, and he expected nothing less than perfection from his daughters. Born in 1919, Jane absorbed her father's unwavering belief that competence could overcome prejudice, that exceptional skill could force open doors that racism tried to keep closed. Dr. Louis Wright had proven this theory throughout his own career, becoming the first black surgeon admitted to the American College of Surgeons and establishing the Cancer Research Center at Harlem Hospital that would later become Jane's scientific home. The Wright household operated on a simple principle. Medicine was both a privilege and a responsibility. Jane's mother, Corinne, had been a teacher before marriage, and she ensured that academic excellence was expected, not praised. Books lined every room of their Harlem brownstone, medical journals stacked beside literature and philosophy texts. Dinner conversations ranged from the latest surgical procedures to the social injustices that kept talented black physicians from advancing in their field. Jane's childhood was shaped by the dual reality of her father's professional success and the constant reminders of the barriers he faced. She watched him prepare twice as hard for every presentation, document his research with meticulous precision, and maintain perfect composure when colleagues questioned his competence based solely on his race. These lessons in resilience and excellence would prove invaluable when Jane faced similar challenges in her own career. The expectation wasn't just that Jane would become a doctor, but that she would excel beyond any reasonable doubt. Her father often said that black physicians couldn't afford to be merely competent. They had to be exceptional. This philosophy would drive Jane throughout her education and research career, pushing her to achieve breakthroughs that couldn't be ignored or dismissed by a medical establishment that questioned her right to be there. Smith College in 1938 felt like another planet for a young black woman from Harlem. Jane Wright arrived on campus with 2 suitcases and an unshakable determination to prove herself among the privileged daughters of white America's elite families. The campus stretched before her like a New England postcard, all ivy-covered brick and manicured lawns, but Jane quickly learned that beauty couldn't mask the subtle barriers that awaited her. In chemistry labs, Jane often found herself working alone as classmates formed study groups without inviting her. Professors called on her more frequently than other students, testing her knowledge with a scrutiny that felt personal rather than academic. She responded by preparing more thoroughly than anyone else, memorizing textbooks and practicing laboratory procedures, until her techniques were flawless. When a chemistry professor questioned her understanding of molecular structures, Jane's perfect answers left no room for doubt about her mastery of the subject. The transition to New York University's medical school in 1941 brought in different challenges. Here, Jane was one of only 9 women in a class of 93 students and the only black student in the program. Male classmates made crude jokes about women doctors, while professors openly questioned whether females had the emotional stability for surgery. Jane absorbed these insults while excelling in every course, earning top marks in anatomy, physiology, and pathology. Her third-year clinical rotations exposed her to the harsh realities of medical practice in the 1940s. At Bellevue Hospital, Jane witnessed the devastating impact of diseases that had no effective treatments. Cancer patients arrived with advanced tumors that surgery couldn't remove and radiation couldn't shrink. She watched physicians shake their heads helplessly as patients died from leukemia, breast cancer, and lung cancer that had spread throughout their bodies. These experiences crystallized Jane's determination to specialize in cancer research. While her female classmates were steered toward pediatrics or obstetrics, Jane announced her intention to pursue internal medicine with a focus on oncology. Faculty advisors tried to dissuade her, arguing that cancer research was too demanding for a woman and that patients wouldn't accept treatment from a black physician. Jane listened politely to their concerns, then continued preparing for her chosen specialty with quiet determination. The oncology ward at Harlem Hospital in 1945 resembled a medieval chamber of suffering more than a modern medical facility. Patients arrived with tumors that had grown unchecked for months, their faces etched with pain that morphine could only temporarily dull. Jane Wright walked these corridors as a junior physician, her crisp white coat a stark contrast to the despair that permeated every room. Treatment options were brutally limited. Surgeons could remove tumors that hadn't spread, but metastatic cancer remained a death sentence. Radiation therapy offered hope for some patients, but the equipment was primitive and the side effects often as devastating as the disease itself. Jane watched colleagues deliver terminal diagnoses with practiced resignation, their clinical detachment masking the frustration of fighting an unwinnable war. Mrs. Sarah Johnson arrived on the ward in September 1945 with breast cancer that had spread to her lymph nodes. A widow with 3 young children, she begged Jane for any treatment that might give her more time with her family. The surgical team had declared her inoperable. Radiation therapy might slow the cancer's progression, but wouldn't stop it. Jane held Mrs. Johnson's hand and promised to explore every possible option, knowing that conventional medicine had nothing more to offer. The pediatric cases were the most heartbreaking. 8-year-old Tommy Martinez was admitted with acute lymphoblastic leukemia, his small body overwhelmed by the cancerous white blood cells multiplying in his bone marrow. His parents spoke only Spanish, and Jane spent hours using her limited vocabulary to explain that their son was dying. Modern medicine, for all its advances in treating infections and injuries, remained powerless against childhood leukemia. These experiences haunted Jane's early career, driving her to spend long hours in the hospital library researching every published study on cancer treatment. She read about experimental approaches being tested in laboratories around the world, most involving chemical compounds that showed promise in animal studies but had never been tested in humans. The scientific literature hinted at possibilities that clinical practice had yet to embrace. Jane began to understand that beating cancer would require a fundamental shift in medical thinking. Instead of viewing tumors as mechanical problems requiring surgical solutions, physicians needed to think of cancer as a chemical imbalance that could be corrected with the right molecular interventions. The answer lay not in sharper scalpels or more powerful radiation, but in understanding how specific chemicals could stop cancer cells from multiplying while leaving healthy tissue unharmed. The basement laboratory at Harlem Hospital became Jane Wright's second home in 1948. While other physicians finished their shifts and went home to dinner with their families, Jane descended to the windowless room filled with microscopes, petri dishes, and chemical solutions that represented the cutting edge of cancer research. Her laboratory notebook filled with detailed observations about how various compounds affected cancer cell growth. data that would eventually revolutionize oncology. The concept of chemotherapy existed primarily in theory when Jane began her research. Scientists understood that certain chemicals could slow or stop cell division, but translating this knowledge into effective cancer treatments remained largely unexplored territory. Jane's approach was methodical and revolutionary. She would test dozens of compounds systematically, documenting their effects with scientific precision and building the foundation for evidence-based cancer treatment. Her first breakthrough came with amenopterin, a drug that interfered with folate metabolism in rapidly dividing cells. Jane observed that cancer cells, which divided more frequently than normal cells, were particularly vulnerable to this chemical disruption. She carefully documented optimal dosages, treatment schedules, and side effects, creating the first systematic protocols for administering chemotherapy to human patients. The medical establishment viewed Jane's work with skepticism bordering on hostility. Senior physicians argued that poisoning patients with experimental chemicals was unethical, especially when the treatments were being developed by a young black woman without extensive clinical experience. Department heads questioned whether Jane had the judgment necessary to balance potential benefits against obvious risks. Jane responded to this criticism by intensifying her research and documentation. She created detailed case studies showing how chemotherapy could shrink tumors that surgery couldn't remove. Her patient files contained before and after photographs, demonstrating dramatic improvements in cancer patients who had been considered terminal cases. When colleagues questioned her methods, Jane presented overwhelming evidence of her treatment's effectiveness. The breakthrough that silenced her critics came in 1950 when Jane successfully treated a child with acute leukemia using methotrexate, a refined version of amenopterin. The 6-year-old patient, who had been expected to die within weeks, experienced complete remission of his cancer. Word of this success spread through the medical community, forcing even Jane's harshest critics to acknowledge that chemotherapy represented a genuine advance in cancer treatment. Jane's systematic approach to drug testing became the gold standard for oncology research worldwide. Her protocols emphasized careful patient monitoring, precise dosage calculations, and detailed documentation of both positive and negative effects. This methodical approach transformed chemotherapy from experimental guesswork into legitimate medical treatment. Jane Wright's most significant scientific contribution emerged from her frustration with the slow pace of cancer drug testing. Traditional research methods required treating patients with experimental compounds and waiting months to observe results, a process that was both ethically questionable and scientifically inefficient. Jane revolutionized this approach by perfecting techniques for growing human cancer cells in laboratory conditions, allowing researchers to test dozens of treatments simultaneously without risking patient safety. The tissue culture laboratory Jane established at Harlem Hospital resembled a garden, dedicated to growing death. Rows of petri dishes contained samples from every type of human cancer: breast, lung, colon, leukemia, and rare malignancies that most physicians encountered only once in their careers. Each culture was carefully maintained at body temperature in nutrient solutions that mimicked the human bloodstream, creating artificial environments where cancer cells could multiply exactly as they would inside living patients. And Jane's innovation lay in her systematic approach to testing cancer drugs using these cultured cells. She would expose identical cancer cell samples to different experimental compounds, carefully documenting how each treatment affected cell division, growth patterns, and survival rates. This parallel testing allowed her to screen dozens of potential chemotherapy agents in weeks rather than years, accelerating the pace of cancer research by orders of magnitude. The precision of Jane's tissue culture work astounded her colleagues. She could predict with remarkable accuracy how specific cancer patients would respond to particular chemotherapy drugs by testing their tumor cells in laboratory conditions. This personalized approach to cancer treatment represented a fundamental advance in medical practice, moving beyond one-size-fits-all protocols toward treatments tailored to individual patients' specific cancer types. International medical organizations began requesting Jane's assistance in establishing similar tissue culture laboratories around the world. She traveled to hospitals in Europe, Africa, and Asia, training researchers in her innovative techniques and helping establish cancer research programs that used her methods. These international collaborations expanded the global database of cancer cell behavior and drug effectiveness. The tissue culture revolution Jane initiated had implications beyond cancer research. Her techniques were adapted for testing treatments for other diseases, advancing medical research in fields ranging from infectious disease to genetic disorders. The systematic approach she developed for growing human cells in artificial conditions became a cornerstone of modern biomedical research. Jane's tissue culture work also addressed practical concerns about patient care. By testing experimental drugs on cultured cancer cells before administering them to patients, physicians could avoid subjecting terminally ill individuals to treatments that were unlikely to be effective. This ethical advance in clinical research protected vulnerable patients while accelerating the development of genuinely promising therapies. The chaos of early cancer treatment appalled Jane Wright's scientific sensibilities. Physicians administered chemotherapy drugs in wildly different dosages, schedules, and combinations, often basing these critical decisions on intuition rather than evidence. Patient outcomes varied dramatically even when treating identical cancer types, a situation Jane recognized as both scientifically indefensible and morally unacceptable. She set about creating standardized treatment protocols that would bring precision and predictability to cancer care. Jane's approach to protocol development reflected her training in both clinical medicine and laboratory research. She analyzed treatment outcomes from hundreds of cancer patients, identifying patterns that revealed which drug combinations were most effective against specific tumor types. Her protocols specified exact dosages calculated according to patient weight and kidney function, treatment schedules designed to maximize cancer cell death while allowing healthy tissue recovery, and monitoring procedures to detect side effects before they became life-threatening. The development of combination chemotherapy protocols represented Jane's most significant clinical achievement. She discovered that using multiple drugs simultaneously could prevent cancer cells from developing resistance to treatment, a phenomenon that had limited the effectiveness of single-agent chemotherapy. Her carefully designed combinations attacked cancer cells through different biological pathways, making it nearly impossible for tumors to develop the genetic mutations necessary to survive treatment. Jane's protocols transformed the treatment of childhood leukemia from a father's fives, uniformly fatal diagnosis to a curable disease in many cases. Her systematic approach to combining methotrexate with other chemotherapy agents produced remission rates that astonished the medical community. Children who would have died within weeks of diagnosis were surviving for years, with many achieving complete cures that allowed them to grow up and lead normal lives. The standardization of cancer treatment protocols had profound implications for medical education and practice. Jane's detailed treatment manuals allowed physicians at any hospital to provide state-of-the-art cancer care, regardless of their previous experience with chemotherapy. This democratization of oncological expertise saved countless lives by ensuring that effective treatments were available to patients in small community hospitals as well as major medical centers. Resistance to Jane's protocols came from physicians who preferred to rely on their clinical judgment rather than following standardized treatment plans. Some colleagues accused her of reducing the art of medicine to cookbook recipes that ignored individual patient needs. Jane responded by demonstrating that her evidence-based protocols produce superior outcomes compared to individualized treatment approaches, forcing critics to acknowledge the superiority of systematic cancer care. The international adoption of Jane's chemotherapy protocols represented a triumph of scientific medicine over regional medical traditions. Hospitals around the world began using her standardized treatments, creating a global network of cancer care centers that shared common approaches and treatment philosophies. Jane Wright's scientific achievements unfolded against a backdrop of systematic exclusion from the medical establishment's most prestigious institutions and professional. While her research revolutionized cancer treatment, She faced constant reminders that many colleagues viewed her as an interloper in a profession reserved for white men. The American Medical Association's local chapters routinely excluded black physicians from meetings, conferences, and social events where informal professional networks were established and maintained. Professional conferences presented particularly painful challenges for Jane's career advancement. Scientific meetings, where she should have been presenting her groundbreaking research, often took place at hotels that refused to accommodate black guests, or in cities where restaurants wouldn't serve her meals. Jane developed strategies for navigating these humiliations, sometimes staying with local black families when hotels were unavailable, and focusing intensely on her research presentations, while ignoring the social ostracism that surrounded her. The exclusion extended to professional recognition and career opportunities. Medical journals initially rejected Jane's research papers not because of scientific flaws, but because editors questioned whether work by a black woman could meet their publication standards. When her papers were eventually published, they often appeared without the fanfare and editorial commentary reserved for research by white male physicians. Awards and honors that should have accompanied her discoveries were consistently delayed or denied altogether. Jane's response to these professional obstacles revealed both her strategic intelligence and her unwavering commitment to advancing cancer treatment. Rather than confronting discrimination directly, which would have provided her critics with excuses to dismiss her work, Jane allowed her research results to speak for themselves. Her treatment protocols produced superior patient outcomes that couldn't be ignored or explained away by prejudice. The establishment of her own research programs and training initiatives provided Jane with platforms independent of discriminatory institutions. She created mentorship networks for young black physicians and women entering oncology, ensuring that future generations would face fewer barriers than she had encountered. These informal academies produced dozens of skilled cancer researchers who continued Jane's scientific legacy while advancing her social justice agenda. International recognition offered Jane refuge from domestic discrimination. Foreign medical organizations eagerly sought her expertise, providing opportunities for collaboration and recognition that American institutions withheld. Jane's travels to establish cancer treatment centers in developing countries demonstrated that scientific excellence transcended the racial and gender barriers that constrained her. Career at home. The personal cost of fighting simultaneous battles against cancer and discrimination took its toll on Jane's family life and health. Colleagues noticed that she worked longer hours than anyone else in her department, partly because her research demanded perfection, but also because proving herself required extraordinary efforts that white male physicians never had to make. The invitation arrived on elegant letterhead from the World Health Organization in Geneva, requesting Dr. Jane Wright's participation in establishing global standards for cancer treatment. The year was 1955, and while American medical institutions still questioned Jane's qualifications, international organizations recognized her as one of the world's leading oncology experts. This invitation marked the beginning of a second phase of Jane's career, one where her expertise was celebrated rather than challenged. Jane's first international assignment took her to Ghana, where she helped establish West Africa's first comprehensive cancer treatment center. Working with local physicians who were eager to learn her tissue culture techniques, Jane adapted her protocols to address tropical cancers rarely seen in American hospitals. The Ghanaian medical team embraced her systematic approach to chemotherapy, and within 2 years, the Accra Cancer Center was producing remission rates comparable to the best American hospitals. European medical schools competed for Jane's services as a visiting lecturer and research consultant. Her presentations at the University of Edinburgh, the Karolinska Institute in Stockholm, and the Curie Institute in Paris drew standing ovations from audiences who appreciated both her scientific insights and her elegant presentation style. These international lectures allowed Jane to share her research with physicians who evaluated her work purely on its scientific merits. The contrast between Jane's international acclaim and her treatment in American medical circles became increasingly stark. While she was advising government health ministries and training physicians in dozens of countries, Several major American hospitals still refuse to offer her staff appointments. International colleagues expressed bewilderment at America's failure to fully utilize one of its most talented cancer researchers. Jane's influence on global cancer care extended far beyond her direct clinical work. The protocols she developed became standard treatment worldwide, translated into dozens of languages and adapted for use in countries with limited medical resources. Her tissue culture techniques were taught in medical schools from Tokyo to London, creating a generation of researchers trained in her innovative methods. The establishment of the International Cancer Research Network in 1958 represented the culmination of Jane's global influence. This organization, which she helped design and launch, connected cancer researchers around the world, facilitating the sharing of treatment protocols and research findings. The network's annual conferences brought together oncologists from every continent, creating collaborative relationships that accelerated the pace of cancer research worldwide. Jane's international travels also provided her with perspective on American medical discrimination. In many countries, her race and gender were curiosities rather than barriers, allowing her to experience professional relationships based purely on intellectual respect. These experiences reinforced her determination to create similar opportunities for other marginalized researchers, leading to her later advocacy for diversity in American medical education. 7-year-old Maria Santos arrived at Harlem Hospital in March 1952 with acute lymphoblastic leukemia, her small body overwhelmed by cancerous white blood cells that had replaced her healthy bone marrow. Her parents spoke limited English, communicating their desperation through tears and gestures as they begged Jane Wright to save their daughter. 2 years earlier, Maria would have died within weeks of her diagnosis. Instead, she became one of the first children to receive Jane's revolutionary combination chemotherapy protocol. The treatment required precise timing and careful monitoring. Maria received methotrexate injections, followed by leucovorin rescue therapy designed to protect her healthy cells from the chemotherapy's toxic effects. Jane personally oversaw every aspect of Maria's care, adjusting dosages based on daily blood counts and watching for signs of infection or bleeding that could prove fatal in her immunocompromised state. The little girl's response exceeded even Jane's optimistic expectations. Within 6 weeks, Maria's bone marrow showed no evidence of leukemia cells. Her energy returned, her appetite improved, and she began playing with toys her parents brought to her hospital room. After 3 months of treatment, Maria was declared in complete remission, free to return home and resume the childhood that cancer had interrupted. She would grow up to become a teacher, marry, and raise 3 children of her own, never forgetting the doctor who had given her life back. Robert Chen was 43 when testicular cancer threatened to destroy his future as a research physicist. The tumor had spread to his lymph nodes and lungs by the time he reached Jane's clinic in 1954, making surgical cure impossible. Jane's tissue culture testing revealed that his cancer cells were highly sensitive to a combination of chemotherapy drugs she had been refining. The treatment would be aggressive and dangerous, but Robert's youth and otherwise excellent health made him an ideal candidate. The chemotherapy regimen Jane designed for Robert pushed the boundaries of what cancer patients could tolerate. High-dose drug combinations that would have been lethal if administered incorrectly were carefully calibrated to his body weight, kidney function, and tumor characteristics. Robert experienced severe nausea, hair loss, and fatigue that left him bedridden for days after each treatment cycle, but his cancer began shrinking almost immediately. After 8 months of treatment, scans showed no evidence of cancer in Robert's body. He returned to his research position at Columbia University, where he continued working until his retirement 30 years later. Robert attributed his survival not just to Jane's medical expertise, but to her unwavering confidence that his cancer could be beaten. Her optimism during his darkest moments gave him the strength to endure treatment that seemed worse than the disease itself. These success stories multiplied throughout the 1,950 seconds as Jane's protocols proved effective against cancers that had previously been considered uniformly fatal. Each cure validated her systematic approach to chemotherapy and demonstrated that cancer, despite its fearsome reputation, could be conquered through scientific precision and unwavering determination. The letter arrived at Jane Wright's office on a Tuesday morning in 1961, handwritten on college stationery by a young black woman seeking advice about pursuing a career in oncology. Susan Williams was completing her undergraduate degree at Howard University and dreamed of becoming a cancer researcher, but her professors had warned her about the obstacles facing women and minorities in medical research. Jane's response would launch a mentorship relationship that exemplified her commitment to opening doors for the next generation. Jane invited Susan to spend a summer working in her laboratory, providing hands-on experience with tissue culture techniques and chemotherapy research. This informal apprenticeship program grew into a structured training initiative that attracted promising young researchers from across the country. Jane's laboratory became a breeding ground for future oncology leaders, many of whom were women and minorities who might otherwise have been excluded from elite research opportunities. The training program Jane established emphasized both scientific excellence and professional development. Her protégés learned not only how to conduct cutting-edge cancer research, but also how to navigate the political realities of academic medicine. Jane taught them to document their work meticulously, present their findings with confidence, and build collaborative relationships that would sustain their careers through inevitable setbacks and discrimination. Dr. Patricia Johnson became one of Jane's most successful protégés, establishing a pediatric oncology program at Children's Hospital of Philadelphia that saved thousands of young lives. Dr. Maria Rodriguez pioneered breast cancer research at the University of Texas, developing screening protocols that dramatically improved early detection rates. These women carried Jane's scientific methodology and professional philosophy into their own careers, multiplying her impact across multiple institutions and specialties. Jane's influence extended beyond her direct mentees to reshape the entire culture of cancer research. She advocated for the inclusion of women and minorities in clinical trials, recognizing that effective treatments needed to be tested in diverse patient populations. Her emphasis on systematic data collection and evidence-based protocols became standard practice in oncology departments worldwide. The establishment of the Jane Wright Cancer Research Fellowship in 1965 formalized her commitment to training the next generation of oncologists. This competitive program provided research, funding, and mentorship for young physicians from underrepresented backgrounds, ensuring that talent rather than privilege would determine who received advanced training opportunities. The fellowship program continues today, having supported hundreds of researchers who have advanced cancer treatment and medical equity. Jane's role as a mentor required balancing encouragement with realistic preparation for the challenges her protégés would face. She shared stories of her own struggles with discrimination while emphasizing that scientific excellence could overcome prejudice. Her advice combined practical career guidance with inspiration, helping young researchers develop both the technical skills and emotional resilience necessary for successful careers in competitive medical fields. The microscope sits in the Smithsonian now, its brass fittings polished to museum perfection, a silent testament to the revolutionary work that began in a basement laboratory at Harlem Hospital. Visitors pause before the display case, reading about Dr. and Jane Cooke Wright's contributions to cancer treatment, perhaps not fully grasping that the woman who peered through this lens fundamentally changed humanity's relationship with one of its oldest enemies. Jane Wright died in 2013 at age 93, having witnessed the transformation of cancer from an almost universal death sentence into a collection of treatable diseases. The chemotherapy protocols she developed in the 1950s evolved into sophisticated treatment regimens that now save millions of lives annually. Children diagnosed with acute lymphoblastic leukemia, the disease that was uniformly fatal when Jane began her career, now have cure rates exceeding 90%. Her tissue culture techniques became the foundation for modern drug development, accelerating the discovery of new cancer treatments while protecting patients from ineffective experimental therapies. Every cancer drug approved today undergoes testing that traces its methodology back to Jane's innovative laboratory work. The systematic approach she brought to oncology transformed cancer treatment from intuitive art into precise science. The barriers Jane broke extended far beyond her own career achievements. The women and minorities she mentored now lead cancer research programs at major medical centers worldwide, their success validating Jane's belief that excellence transcends prejudice. Medical schools that once excluded talented individuals based on race and gender now actively recruit diverse students, recognizing that breakthrough discoveries emerge from diverse perspectives. Perhaps Jane's greatest legacy lies in the countless patients who never knew her name but owe their lives to her work. The grandmother watching her grandchildren graduate, the father coaching Little League, the teacher inspiring future scientists, all represent victories in the war against cancer that Jane helped humanity win. Their lives continue the story she began, cells remembering to divide and grow and flourish, no longer stopped by the disease that once seemed unstoppable.